Senator Hatch and Senator Enzi have laid it out very well, and I'll try to focus my remarks on just two aspects of this. First of all, the healthcare policy aspect of what we now see 1 year later, and the fiscal aspect of what we now see 1 year later. On the policy side, you'll all recall during the debate, the issue was rising premiums and how do we deal with access to healthcare. Now 1 year later, we see the result. It's exactly what we argued at the time. The headlines are premiums are going up and benefits are going down. Employees in small businesses are seeing their wages impacted and their employment opportunities impacted. And unemployment is growing as a result of the pressures, the regulatory and financial pressures that the bill created. At the time when we debated the bill, we talked about the fact that the only way on a fiscal level that a claim could conceivably be made that the bill was deficit neutral or actually helped to reduce the deficit was to cut Medicare by $500 billion, to increase taxes by $500 billion or more, and then engage in the various budget gimmicks that simply just shifted the cost and revenue portions of the bill in such a way to make it balance out. America is now seeing the reality on a fiscal level, that this bill is, in fact, a huge expansion of the federal government. As Senator Hatch said, a $2.6 trillion increase in federal spending over the next 10 years. That is just adding to our problems now of trying to deal with our national debt. Our national debt, already over $14 trillion, approaching 100% of our GDP, is being fueled in significant part by the massive explosion of healthcare spending that is put into effect by this law. And again, the only offsets that were of significance were the phenomenal hit on Medicare, which, as Senator Hatch mentioned, was double counted in terms of the numbers, and the phenomenal hit on taxes that Americans are now paying. And what we are now seeing, which was really hidden in the bill, which is the phenomenal hit on employment in this country as small businesses across the country are forced to retrench in the face of the mounting pressures of increased benefit costs for their employees. The fact is that we could have and should have done much better. There were solutions that were proposed at the time. Those solutions need to be considered now that can truly help to reduce the cost of health care and to increase the access of health care without putting the federal government in such a massive control position in the healthcare economy and without growing the federal government in such a massive way.